Roger's approach to eating disorder treatment is really based in cognitive behavioral therapy, which is a very well-researched form of treatment that we know is effective for treating eating disorders, as well as a variety of other mental health conditions. But there are some special parts of CBT that we particularly use with eating disorders. At Roger's, one thing that really makes us unique is that we focus in particular on one element of cognitive behavioral therapy, which is exposure therapy. Exposure therapy is something that historically has been used with treating anxiety disorders and OCD, but really what it's about is addressing the fear and anxiety and other distressing emotions that come along with really any mental health disorder. Oftentimes those fears and anxiety is related to things like eating certain kinds of foods, eating in certain kinds of ways, about our bodies, about doing physical activity or not doing physical activity. So all of those things that we are avoiding due to fear, anxiety, and distress, we can target with exposure therapy. What that does is we have people systematically confront or face those fears, the things that make them feel anxious and that they tend to avoid or do other things to try to minimize that anxiety. And by doing that, they're able to do a couple things. They're able to build some distress tolerance skills. So they're able to learn to tolerate the distressing emotions that might come up with a little bit more confidence. They're also able to get some new learning. Oftentimes when we avoid doing the things that we're scared of, that means that we're kind of depriving our minds of the opportunity to get new information that maybe that scary thing isn't so likely to happen. So we can confront that situation, we can actually see what happens rather than just going based off of what our mind tells us is gonna happen. And then we get new information that we can then can help us correct and alleviate that anxiety in the next situation. And then I think one of the most important things with exposure therapy is that the more we avoid, again, the smaller our life gets. So when we're challenging that avoidance, when we're not letting the eating disorder boss us around and tell us what we can and can't do and what we need to avoid or how we need to do something, then we're taking our life back and we're able to make our life bigger again and start to do the things that are important to us and not just the things that the eating disorder is asking us to do.